Welcome everyone. My name's Shannon Watson. I work for Christian Hospital EMS. I've been there for just about 7 years and I am the community health supervisor. So we focus a lot on preventative medicine and trying to get out in the community and creating a healthier community. This is a little bit about our program. So we have Mobile Integrated Health, or CHAPS, as some people have heard of it. Like I said, we're all about preventative medicine, kind of being patient advocates, connecting them to resources, getting them education, and really being there for our patients. And the reason we do this, I don't know if anybody's heard of it, I'm sure you have, but the Affordable Care Act. So in 2010, this act was passed, and a lot of people think of it as healthcare reform and bringing health insurance into our community. But we as providers also need to realize this affects us as well. So not only does it bring healthcare to our community, but also it holds us accountable. And it's truly about, are we providing the right care at the right time? Is it quality care? And are our patients satisfied with it? So back in the day, it was always fee for service. You come into the hospital or you call 911, you go into an ambulance, and we do certain things and we charge you fees because of that. Well, now what they're saying is, hold on, it's not just about fee for service, but did this patient really need that? And if they did need it, did you increase or did you give them a good quality of care? Did they get better from it? And then in addition to that, were they satisfied? So nowadays, you can't just come into an ER, do all of this stuff and expect to get payment. You actually need to do good quality work. The patient needs to actually need what they're getting. And then in addition to that, they have to be satisfied. So the Affordable Care Act is not just about healthcare reform. It's also having accessibility to the healthcare or to the healthcare needs, and then providing those resources at the right time in the right place. So kind of what we focus on with CHAPS, or Mobile Integrated Healthcare, is our 5 rights. So is this the right patient? You know, are they getting that right healthcare at the right cost, good outcomes, and then good resources? And it's not just about CHAPS that we need to focus on this. Every single healthcare provider has got to start focusing on this, because nowadays it's all about that triple aim. I'm not sure if you've heard of it, but it's all about population health, cost per capita, and then their experience of care. So it's not just us in this CHAPS program that has to focus on it, but every single person in the healthcare field. So what we do, we have a bunch of advanced practice paramedics that have additional training, and they go out and they try and get these patients the resources they need. They try and provide education, and we try and kind of help those patients that fall through the gaps. But here's what I need from you all. We've all got to step up, and we all have to be good patient advocates. We all have to provide education, and we all have to try and help with these barriers to wellness. And so that's what we'll kind of talk about today. So what are the barriers? As an EMS provider, I'll tell you right now, a lot of our barriers is our patients don't understand their discharge paperwork. So they go into the hospital or they get admitted, you all discharge them, and maybe you have a new patient coming in, so you can't spend a lot of quality time with them. They go home and then they call 911 again because maybe they didn't understand what their illness was, or maybe they don't have accessibility to their prescription medications. Maybe they don't know to follow up with their primary care physician, or maybe they don't have transportation. So those are all huge barriers to wellness. So I challenge you to get in there, and next time you discharge that patient, whether it's from an emergency department or from the floor, really sit down with that patient, spend that quality time with them, make sure that they understand their illness and that disease process and what they have to do to get better. If they don't have a primary care physician, either try and assist them with that or get a social worker in there. And then transportation, like I said, you may get them a primary care physician, but if they don't have a ride to that primary care appointment, guess what? They're going to call 911, wind up right back in our ER, getting health care at a higher cost where they really don't need it. So try and familiarize yourself on stuff like that. Another big thing with medications, I don't know if you realize this, but there's actually a $4 med list. So patients may be spending $150 on medications when if they get a generic med, they can find it on the $4 list. I know there's different places that have this, like Walmart or Schnucks. So that's something that we can provide to our patients to try and help them. So these are all very quality things. Like I said, we've really got to focus on that triple aim. So we need to focus on providing our patients that quality care, being there for them, being an advocate, and really giving them that education so that they can be successful and have a higher quality of life in the end. If you have any questions, please feel free to contact me. Once again, my name's Shannon Watson. Here's my email address, and I'd be more than happy to help you all with any questions. Thank you.